Hi everyone, welcome back to our channel Magic of Medicine, where we simplify the concepts. Today we are diving into the fascinating world of pediatric radiology to discuss the double bubble sign. What is it, why does it occur, and what conditions is it associated with? Also, it is an important exam and OSCE question. So let's get started. Now, what is the double bubble sign? Double bubble sign is a classic radiographic manifestation of duodenal obstruction seen in newborns typically. It gets its name from the X-ray representation of two distinct round air-filled structures seen in upper abdomen, representing stomach and duodenum, and more precisely the duodenal cap. So here there are two bubbles seen in upper abdomen, hence the name double bubble sign. It represents dilatation of stomach and proximal duodenum, more precisely what? Duodenal cap. The larger proximal bubble is caused by gastric distension, as I mentioned, and smaller distal bubble is caused by dilated duodenal bulb. So on this X-ray I have shown you the double bubble sign. That does not mean that this sign is only assessed on X-ray. We can also see this sign in antenatal USGs also. Now coming to the causes. The most common cause of double bubble sign is duodenal atresia. However, we will read all the causes. So we have divided the cause list into 3 points: intraluminal causes, extraluminal causes, and midgut volvulus. Intraluminal causes include duodenal web, duodenal atresia, duodenal stenosis. Any duodenal cause which is obstructing the duodenum from its lumen consists intraluminal cause. Then coming to extraluminal cause, here I have a mnemonic A, B, C. A is 1, B are 2, and C are 3. So A is annular pancreas, B for remember bleed, and B for blood vessel. Bleed, that is intramural duodenal hematoma. It will also lead to duodenal obstruction and double bubble sign. Second, B is for blood vessel. It includes an artery syndrome and a vein disease. Artery is SMA syndrome. We know that SMA compresses the duodenum and leads to duodenal obstruction in case of SMA syndrome. And when portal vein is located pre-duodenally, we know commonly portal vein is located away and does not obstruct the duodenum, but sometimes the portal vein is pre-duodenal in its location, and wherein it can cause mass effect and leads to duodenal obstruction, hence double bubble sign. And then we have 3C. One cyst is choledochal cyst, other cyst is duplication cyst, and other C is cancer, that is retroperitoneal tumor. Any retroperitoneal tumor which leads to obstruction or compression of duodenum will lead to duodenal obstruction, and in turn double bubble sign is seen. So these extraluminal causes are the external compressions. External is A for annular pancreas, B is for bleed and blood vessel, and C is for cyst and cancer. So these are the causes, and I have also told you the mnemonic to remember the causes. Now coming to the clinical features. Obviously, here there is a bowel obstruction occurring. So patient will present with vomiting, abdominal distension, and failure to pass meconium, because see, obstruction has occurred here. So any food material, anything, meconium or anything will not be able to pass distal to this. So failure of meconium passing will be noted in some cases. Next, diagnosis. So we have three modalities on which we can assess the double bubble sign. First is X-ray, second is barium study, and third is antenatal USG. So here I have shown you an X-ray wherein there is a proximally dilated stomach and then dilated duodenal bulb, and thereafter in distal abdomen we are not able to see any gas or air, so this is double bubble sign. Then we have performed barium swallow, so we can see that contrast media is seen in dilated stomach and duodenum. Both stomach and duodenum are dilated, and there is no contrast seen in distal part of duodenum and C loop. So again this is a barium representation of double bubble sign. And then this was the appearance on antenatal USG, wherein we can see two dilated bubbles. One represent stomach and the other represent duodenum. Now one by one we will see them again. So what is this? This is an X-ray showing double bubble sign. This is dilated stomach, this is duodenal cap, and there is no air in distal bowel loops, no air. So this is double bubble sign and it represents duodenal atresia. So examiner will ask you why it is not duodenal stenosis and why I saying as duodenal atresia as the first DD. So you have to answer if distal gas was present, then duodenal stenosis would have been my first differential over atresia, because in stenosis some air will leak and go into the distal bowel loops, while in atresia there will be complete blockage of duodenal in lumen and there will be no air seen in distal bowel loops. So this is the X-ray showing double bubble sign. Now coming to barium swallow. So barium swallow shows distended stomach and proximal duodenum with known visualization of contrast media in distal bowel loops. So this is suggestive of duodenal obstruction. Now coming to antenatal USG. In antenatal USG you will see two anechoic areas in upper abdomen which are interconnected. The stomach is on the left of the midline and duodenum is on the right of the midline. Again, this is USG appearance in another patient. Again you are seeing two fluid filled bubbles, one on the right side and one on the left side of midline, and these are interconnected also. So this again represents double bubble sign, and the differentials I have told you already. Now I have shown all these in single slide. This is X-ray showing double bubble, this is stomach, this is duodenal cap, again this is stomach, this is proximal duodenum, no contrast distally, no air distally, and this USG is showing again duodenum and stomach as two bubbles. Again I have zoomed one for you. This is stomach, this is duodenum, both are over distended and no air is seen distally in the bowel loops. Now coming to the summary. So to summarize, the double bubble sign is an important radiological finding in newborns, indicating potential proximal bowel obstruction. Recognizing it early can make a huge difference in patient outcomes. Again, we will re-revise with the help of OSCE or Viva questions. So first question is identify the radiographic and sonographic abnormality. So first thing is you need to identify the sign. So in X-ray you will see disproportionately enlarged or distended stomach and duodenum with paucity of gas in distal abdomen, distal bowel loops. Again, over distended stomach and duodenum with no contrast in distal bowel loops or paucity of contrast in distal bowel loops. On USG, again dilated double bubble. So now you have identified. So next question of the examiner will be, tell me the causes of this pathology. So causes I have already told you. Causes you have to divide them into three: intraluminal, extraluminal, and midgut volvulus. Extraluminal, I have told you a mnemonic: A1, B2 and C3. A1 is for annual, means 1 point of A, B 2 points and 3 C points. So 1 is annular pancreas, A for annular pancreas, B is for bleed, second B is for, what is second B is for? First B is for bleed, second B is for blood vessel. Blood vessels includes arterial course and one venous course. Artery, we know which artery can lead to duodenal obstruction, SMA, and which vein can lead, portal vein, when it is pre-duodenal in its location. And 3 C's are for 2 cysts. One is choledochal cyst, another is duplication cyst, and third C is cancer. And which cancer can lead to duodenal obstruction? Obviously, duodenum being a retroperitoneal structure in few parts, so retroperitoneal malignancy leads to duodenal obstruction by causing its external compression. Now examiner will ask you which is the most common cause of double bubble sign. So you have to tell the most common cause is duodenal atresia, and then he will ask what is the most common association of duodenal atresia. Then you have to answer, sir, the most common association is Down syndrome. Then he will ask, what are the other such signs? What is single bubble sign and what is triple bubble sign? So tell me, what is double bubble, what is single bubble, and what is triple bubble? So single bubble is just the stomach is dilated and you see only a single bubble in upper abdomen, and it is commonly seen in congenital hypertrophic pyloric stenosis. Then double bubble, I have told you already, and triple bubble is where you see dilated stomach, duodenum, and jejunum, and it is commonly seen in jejunal atresias. So that was all about double bubble sign. Hope you found this video useful. If you found it useful, please like, share and subscribe.